6 na.
We three kings of Orient are, bearing gifts we traverse afar, field and fountain, moor and mountain, following yonder star. The star, born a king on Bethlehem's plain, gold I bring to crown him again, king forever, ceasing never over us all to reign. Oh, star of wonder, star of night, star with royal beauty bright, westward leading, still proceeding, guide us to the light. Frankincense to offer have I, incense songs a deity nigh, prayer and praising, all men raising, worship him God most high. Oh, star of wonder, star.
Welcome everybody from Luzon, from Visayas and Mindanao. Welcome. Let us start this session with an invocation and the national anthem.
Ama namin, pakinggan mo po ang pagtawag namin sa iyong banal na pangalan. Basbasan mo po ang aming pagtitipon at kami kaluguran mo sa araw na ito. Pagyamanin mo po, Panginoon, at maging nakaayon sa iyong kalooban ang aming pagkikita-kita mula sa simula hanggang katapusan. Masalamin nawa namin ang layunin mong dakila sa aming buhay at maisagawa namin ngayon ang aming mga gawain na may kabutihan at pag-ibig sa aming kapwa. Kami po'y naniniklohod sa iyong harapan na kami iyong patnubayan at iwaksi sa aming kaisipan ang anumang masasamang kaisip, inggit at pakikipag-alit sa aming mga kasama. Bigyan mo kami ng sapat na lakas at katalinuhan upang may bahagi naman namin ang aming makakaya sa aming mga kasama sa pagtitipon na ito. Ilagay sa aming diwa at puso ang pagmamahal na hindi naghihintay ng anumang kapalit. Bagkus ay bukas palad na magkakaloob ng anumang tulong. Panalangin namin ang lahat ng ito. Amen.
Kababayan, ang pambansang awit ng Pilipinas.
Kayang mag-ibig, telas ng sinakanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisigil, sa nagatak tutok sa simoy at sa langit mong pagaw, ay
Again, welcome everybody. I'm Dr. Jessica De Leon on behalf of the Philippine Acupuncture Academy of Acupuncture Incorporated. We'd like to spread the light and say a happy evening to all and all of us. Okay. So let's just start with a few house rules. Let us please sit up straight but relaxed to allow also the energy to flow and to maximize this learning session. Let us maintain eye contact, although this is a virtual platform and we don't actually see each other physically. It's still good to maintain eye contact because the eyes are the windows of the liver. They are transmitters of energy and knowledge. Okay. And then please refrain from multitasking. You know, this virtual background requires focusing so that we'll optimize this session. Then please put your audio on mute, but your videos, yes, please turn on your video so we'll see each other. And use your full name in this platform, especially the Zoom link. And please actively participate. So we look forward to active participation through the chat box. As to the questions, we'd like to hear your questions, no? But please hold your questions, hold on to your questions and post them at around 7:30 so that we can monitor because we might not be able to see all the questions if you post them earlier. Okay?
Okay.
So with that, this is put your audio on mute. Okay. And then today we are going to have a special Christmas webinar. We have a special speaker to discuss with us the use of acupuncture for allergy and allergic rhinitis. We have here Dr. Webster Wilfred Lim. He's actually registered nurse. He's a graduate of the San Beda College of Medicine, where he graduated with honors. He has been trained on acupuncture and related modalities, specifically basic and advanced acupuncture and master tone classes at the China Academy of Chinese Medical Sciences. He actually went to Beijing to complete his acupuncture and moxibustion courses, specifically with the China Beijing International Acupuncture Training Center in Beijing, China. Okay, so without further, and of course, he's currently the new PAI president. Okay, so without further ado, we'd like to call on Dr. Webster Lim to please take center stage. Let's give him a big round of applause.
Hello, a pleasant evening to each and every one of you, my beloved PAI members. So thank you very much, Dr. De Leon, for those warm introduction. So on behalf of PAI, I would like to welcome each and every PAI members that are here today who have dedicated their time for attending a charity Christmas lecture for all the PAI members, specifically titled Acupuncture Treatment for Allergy and Allergic Rhinitis. So before I begin, a quick background for this lecture. We decided instead of a Christmas gifts, we deemed that it's also appropriate to give a charity Christmas lecture for all the PAI members for free as a way of giving back to our beloved PAI members in on behalf of the new Board of Trustees of PAI. So this is our gift to you. No? Okay, so with that being said, let us now begin. So So usually, this lecture is based on the culmination of my learning experiences, knowledge, and skills as a medical professional as well as a patient. So different viewpoints, perspectives, and opinions on the topic from various participants are respected and appreciated for maximal learning. And then your utmost attention and listening skills are highly warranted for the lecture. Questions, comments, reactions are highly encouraged throughout the duration of the lecture. So, a very famous quote that I like is from Shakespeare. There is nothing either good or bad, but thinking makes it so, by William Shakespeare. So, I'm here to share to you my experiences with regards to acupuncture treatment for allergy and allergic rhinitis. Although beforehand, I'm also quite sure you guys have already have a good background on how to treat it from a TCM perspective. Okay, so with that being said, let's begin. So, for my educational objectives for the day, I would give a brief medical background of allergy and allergic rhinitis in Western medicine, discuss the mechanisms of type 1 hypersensitivity, discuss allergy and allergic rhinitis in a TCM point of view, give an acupuncture treatment plan for allergy and allergic rhinitis, and present evidence-based medicine with regards to TCM treatment for allergy and allergic rhinitis. So, to begin with, did you know that July 8th is declared as Philippine National Allergy Day? So according to the Serious MD blog, the event has its root on Presidential Proclamation number 978 way back in 2006 when GMA, our former president, declared it as National Allergy Day. So proclamation was a response to survey data indicating that Filipino children had some of the highest incidence rate for allergies and asthma in the region. In fact, allergic rhinitis has been shown to afflict a startling number of Filipinos. So a 2008 survey showed 20% of respondents, no, it affects 20%, roughly 2 out of every 10 Filipinos. So estimates put allergic rhinitis incidence rate for the global population at anywhere from 10% to 30%. According to the Philippine Daily Inquirer, way back in March 2017, the WHO estimates that 50% of the population will suffer from at least one allergy by 2050. So some basic facts, no? People suffer from allergies all year long. Allergies are more common in the urban settings. Allergies are increasingly common due to environmental factors. A skin prick test can identify what you're allergic to. The indoor environment is 5 to 10 times more polluted than the outdoors. And then more people suffer from allergies in spring than in winter. Next, allergies can have serious consequences if left untreated, and it can also develop in elderly at age 60 or even older. Antihistamine treatments allow allergy sufferers to lead normal lives. So depending on how you will respond, no? Because nowadays more and more people are becoming open for an acupuncture treatment as a complementary and then supplementary treatment for their allergy aside from always being dependent on antihistamines. So over the Philippine data, way back in 2001, the most common allergens that can be detected in the Philippines are as follows. We have molds, dust mites, pollen, fish, and pet dander. No? So these are all very common, especially your dust mites and molds. No? Then the prevalence of allergic rhinitis in Filipino adults based on the National Nutrition and Health Survey in 2008, it showed that it's not significantly different across months of the year. So allergy can present all year round. Unlike in other countries, it's more predominant in spring than in winter, and etc. etc. So in a GMA News Online in 2015, hay fever or allergic rhinitis affects 2 out of 10 Filipino adults. No? And then this one is the most latest from the BMC, Allergy, Asthma, and Clinical Immunology, published way back in August 12, 2020. It states that in the Philippines, the reported overall prevalence of allergic rhinitis and allergic rhinoconjunctivitis is 20% and 14% respectively, whereas work absence due to asthma is reported at 46.6%. So it's becoming more and more common nowadays. So 20%, that would roughly translate 1 out of 5 Filipinos, no? So before we begin, let's start off with hypersensitivity. Let's take a look from a Western point of view. So hypersensitivity is an immune response that results in an exaggerated or inappropriate reactions that are harmful to the host, typically occur after the second contact with a specific antigen or allergen. First contact is a necessary preliminary event that induces sensitization to that allergen. So we have four. We have type 1, type 2, type 3, and type 4. So for this lecture, we will focus more on type 1, or your immediate type of hypersensitivity. So for type 1 hypersensitivity, it's also known as anaphylactic hypersensitivity, occurs when allergens bind to IgE on the surface of mast cells with consequent release of several mediators, begins when an antigen induces the formation of IgE antibody. So it binds firmly by its Fc portion to receptors on the surface of basophils and mast cells. So, common mnemonic during our med school time for type 1 hypersensitivity, remember first and fast, no? Or your 2 Fs. So this is a schematic diagram from Robin and Cotran's pathology book, wherein you have an allergen, your pollen will bind to your B cells and then eventually activating your IgE secreting B cells. So once you get an exposure to that allergen, you would release your subsequent mediators, no? Specifically your histamines from your mast cells that can therefore trigger an allergic reaction. So re-exposure to the same antigen results in cross-linking of the cell-bound IgE, the granulation, and release of pharmacologically active mediators within minutes. So you will have symptoms such as your edema and erythema, or your wheal and flare response, and itching would appear rapidly. So the culprit here is most likely your histamine. Then for the late phase, it occurs approximately 6 hours after exposure. So these are due to mediators, specifically your leukotrienes or your SRSA, slow reacting substance of anaphylaxis, that are synthesized after the cell degranulates. So it will cause influx of inflammatory cells, and symptoms such as erythema and induration will occur. So your histamine. It occurs in granules of tissue mast cells and basophils in a preformed state, responsible most of the time for your bronchospasm in anaphylaxis. Whereas your SRSA, composed of several leukotrienes, these are produced during anaphylactic reactions, formed from the arachidonic pathway by the lipooxygenase pathway. So in Western medicine, they evaluate this using a scratch test. So you would look for a wheal and flare reaction. So you will inject intradermally on the skin a suspected allergen, and then the test is read as positive when your area becomes red and swollen. So most of the time, they would test multiple allergens on the arm at the same time to determine what specific allergen you would have a reaction to. And then for the latter test that some people, immunologists, will recommend will be your RAST, or your radioallergosorbent test. So this will detect specific IgE antibodies in serum. No? So examples of type 1 hypersensitivity. Number one, we have your systemic anaphylaxis. So these are caused by foreign proteins, drugs, food, or insect toxins such as your bee sting. So clinical presentation, you will have vascular shock, widespread edema, and difficulty in breathing. Western medicine, the drug of choice is epinephrine for your bronchodilation. Usually this is a medical emergency. Most of the time, when you see this, you would call 911 and subsequently refer the client to the ER for for emergency management, specifically for the airway. Then another one is the atopic hypersensitivity. So these are caused by exposure to pollens, ragweed, dust mites, foods such as your seafoods. Strong familiar predisposition, meaning it has a genetic component. So clinically, this is manifested in the form of urticaria, angioedema, allergic rhinitis, bronchial asthma, and atopic dermatitis. So the treatment for this would include avoidance and antihistamines. So our lecture would focus more or less in this aspect, specifically your urticaria and allergic rhinitis. So aside from the conventional Western treatment of antihistamines, um, people nowadays tend to look at acupuncture in helping resolve their signs and symptoms of atopic hypersensitivity. So to summarize your hypersensitivity reactions, you have four. Specifically, as I have told you, we would focus on type 1, which has a reaction time of 15 to 30 minutes, would most likely focus on your skin and lungs. And then this one can be inhibited by our Western medicine of antihistamines such as your Benadryl, cetirizine, loratadine, and steroids on the more severe stages. And then again, an example of this would be urticaria, allergic rhinitis, bronchial asthma, and anaphylaxis. So I included this table for your reference. So this is in the aspect of Western medicine. So these are just nice to know details on the other types of hypersensitivity. So now let's go over to urticaria in the TCM view. So for the TCM, urticaria. So eruption of the skin characterized by transitory flat top wheals in Western medicine. It's also known as hives or your nettle rash. So you can see, I'm sure some of you here have already experienced this or has this condition when exposed to a certain allergen. So in TCM, this one is apt to appear after exposure to wind. So in TCM, this one is called wind wheel, hidden rash, or wind measles. So in the ancient literature of TCM, specifically your synopsis prescription of golden chamber, if the pathogenic chi attacks the meridians, hidden rash with itching would appear. So your etiology and pathogenesis are, we have three types, no? So we have stagnation of dampness at skin and muscles that is attacked by wind heat or wind cold. Two, we have accumulated heat in stomach and intestines with further attack of the pathogenic wind, which could neither be dispersed from the interior nor removed from the exterior. And number three, intestinal parasitosis or food intake, leading to disharmony of spleen and stomach with accumulation of damp heat in the skin and muscles. So these are the three main etiology and pathogenesis for urticaria. In TCM, usually before we do our treatment, we used to have DCM differentiation. So for urticaria, one of the common syndromes or patterns presenting would be the wind heat type. So the main signs and symptoms will be red rashes with severe itching. And when you do your pulse diagnosis, most often than not, you would always have a pulse that is superficial and rapid, and a tongue with red with yellow thin tongue coating. So in TCM, heat is manifested with red color and itch is manifested in the form of wind. So a wind heat type would have a red and itchy rashes, such as in the pictures as I've shown before you. And then when you take their pulse, it's rapid because of the heat type. And then number two, we have the wind damp type. So for the wind damp type, the main signs and symptoms will be white or light red rashes, heaviness of the body, because as you know, dampness tends to obstruct the meridian, and one common symptom of dampness is heaviness of the body. So we will have a pulse that is superficial and slow. You have a tongue that is swollen with white and sticky tongue coating. So as you can see, as compared to the previous rashes, this type of rashes are presenting in light red, no? And then dampness is manifested as white and slow in terms of characteristics. And then itchiness, again, is a manifestation of wind. Also, the pulse, still superficial, but this time it's slow because of dampness. Then number 3, we have heat accumulation in the stomach and intestines. So the main signs and symptoms for this type of urticaria are red rashes, abdominal or epigastric pain, constipation, or diarrhea. So you would also have a pulse that is rapid because of heat accumulation, and a tongue that has a thin body and yellow tongue coating. So these are the 3 types of TCM differentiation patterns for urticaria. So let's now go over to urticaria treatment. So urticaria treatment, you would generally use a reducing method to disperse wind, damp, and eliminate heat in the blood. Points of the spleen and large intestine meridians are selected as principal points. So your Yang Ming and your Tai Yin meridian, you can select majority of them as your principal points, and you can also do your dermal needle or plum blossom needle tapping. So for urticaria, for point prescription, no, we have several. For the main points, again, Yang Ming meridian, Li meridian, specifically your Li4 and Li11, they disperse pathogenic factors from skin and muscles. Not to mention, they are correlated with the metal element. So metal element is corresponding to lung and large intestine. And if you remember, the skin belongs to the organ of lung. So selecting points of the metal element would tend to help generally with dermatological problems. And of course, our very famous spleen 6 that can remove dampness, not to mention it is an earth point. So if you remember the flow of your 5 elements, earth tends to generate metal, specifically if you have deficiency or low immunity. So you can use earth points as well to generate metal for it. Then spleen 10 and bladder 40, famous points for eliminating heat in the blood. Actually, for me, my favorite would be spleen 10, no? Or the sea of blood. So this one is used to boost blood and boost the blood function so as to disperse heat, and nourish the blood so as to disperse wind. So spleen 10 is a very good acupuncture point, specifically for allergy, urticaria, and allergic rhinitis. Others will use triple warmer 5 or Sanjiao 5, gallbladder 20, and bladder 17. So these are points that are good for wind points, specifically your triple warmer 5 and gallbladder 20. Bladder 17, as you all know, is a back shoe point for the blood. So when you tonify blood one way or the other, you are helping with the managing of the symptoms or discomfort caused by the urticaria. And then for supplementary points, no, based on the TCM syndrome that you diagnose, here are some recommended points according to the books. So for wind heat, you would use famously your GP14 or your DO14 to reduce heat. Very famous point for not only heat, but also for all the yang meridians as well. Then we also have spleen 9, very famous point for removing dampness. So this is most apt for a wind damp type of TCM syndrome of urticaria. Then you can also have stomach 25 and stomach 36, accumulated heat in stomach and intestines. So they can dredge accumulated heat from stomach and your intestines. So these are some supplementary points that you can add to your treatment when you are managing a case of urticaria based on different TCM syndromes. And then for those of you that are fans of ear acupuncture, aside from using the lung, you can also use a what they call the wind stream point, which is located here in the picture, just right across your famous point of Shenmen, no? So you can use this point to stop and relieve itchiness, no? Itchiness and itching, specifically for urticaria or even allergic rhinitis. Other treatments, you would have plum blossom needle, aka dermal needle. So some of you that practices this one, you can use it for urticaria at the lesion site to relieve itchiness, and also for the skin to boost and tonify the lung. No? So usually for urticaria, dermal needle, you will still cleanse the site. So this is a patient with a mosquito bite, actually, with a lesion, very itchy. So he asked me to do a dermal needle for him. So before you do your dermal needle, always cleanse the area and cleanse your equipment or your dermal needle prior to tapping the skin. So this is one another way of also how to address the discomfort due to itching by urticaria. So other people would tend to use your moxa and bleeding cupping or your wet cupping. So this one is used to boost the immunity specifically for moxibustion, and bleeding cupping to remove heat in the blood so as to relieve those reddish lesions that causes your severe itchiness. Okay, so that would be all for urticaria. Let's now go over to nasal disease. No, so the universal symptoms of nasal disease, we have obstruction, rhinorrhea, sneezing, sometimes bleeding and pain, sometimes cannot smell, and also discharge most of the time. Also, so how are the symptoms caused? So technically, you have inhalation of your irritants, specifically in the form of aeroallergens that irritates your free nerve endings that leads to itching and sneezing, increased mucus production, which produces the symptoms of rhinorrhea, vasodilation, which produces your nasal congestion, and increased vascular permeability, which can contribute to edema or swelling around the area. No? So where and how do you acquire nasal disease? So generally, when you have a history of allergy and atopic disease, you are more prone to having allergic rhinitis because they share a same genetic component. Other causes would be smoking, pets at home, specifically their fur, occupation based on your work environment, history of previous surgery and trauma, general medical history, seasonal or daily variation in symptoms. So these are more pronounced in countries where you have many seasons, specifically your spring and even winter. No? Next, allergic rhinitis. So clinically defined as a symptomatic disorder of the nose induced by an IgE-mediated inflammation after allergen exposure of the membrane linings of the nose. So your symptoms of allergic rhinitis, you have repetitive sneezing, watery rhinorrhea, or your watery nasal discharge, nasal congestion, and pruritus. Some people would have eye and ear symptoms and postnasal drainage. That's why if you remember in the earlier slide, allergic rhinoconjunctivitis contributes to 14% here in the Philippines for people with the component of allergic rhinitis. So the causes, no? You have inhalation of your pollen, grass, and weeds, from house mites to animal dander, from specific food products such as your wet, eggs, milk, and nuts that can lead to allergic rhinitis. So same concept also with the allergen sensitization. So on first exposure, you will tend to have an IgE antibody attached to your muscle. And then when you have a re-exposure, it cross-links and release your primary and secondary mediators, which can contribute to the spectrum of anaphylaxis, asthma, and allergic rhinitis. So to classify allergic rhinitis, it can be classified as mild, wherein you have normal sleep and no impairment of daily activities. Then for moderate or severe, it tends to hamper or impair your daily activities, and it can also impair your work and school schedule. No? But generally, for the ENT physicians, what they use as a classifications are intermittent and persistent. So you have to remember the rule of four. When you say an intermittent allergic rhinitis, it's less than 4 days per week or less than 4 weeks. For persistent allergic rhinitis, more than 4 days per week and more than a month when you have the symptoms. So how do you diagnose your allergic rhinitis? Basically, it's more or less clinical diagnosis. So you assess the patient's clinical history. You do your physical and nasal examination and note for an allergic shiner, wherein they tend to have a specific area at the nose where it's inflamed or even shiny, no? That's why they call it allergic shiner. Next, some people will have a Denny Morgan line at the eyes, specifically with the spectrum of allergic rhinoconjunctivitis due to constant irritation at the local area caused by the release of your histamine by your muscles. No? Next. And then allergic crease for some people. Just like this pediatric case here, wherein she has a crease on the bridge of her nose. And then when you do your nasal rhinoscopy, you will tend to see a pale and boggy turbinates with rhinorrhea or your nasal secretions. So you will have a congested or reddened nasal turbinates. In the pediatric classification, some pediatric patients will always tend to rub their nose. That's why it's laymanly called as an allergic salute. Then for laboratory testing, you do your skin prick test, just like for urticaria, so as to check, no? So as to check what allergen you're sensitive to, no? Then third, more commonly, these are for the ENTs. They tend to do your lab testing, such as your rhinomanometry, and peak nasal inspiratory flow rate. So how do you manage allergic rhinitis? Number one, first and foremost, allergen avoidance is still the best strategy. So for those that have allergen suspicion because of material things, technically you tend to remove the source of those allergens, such as your rugs or drapes, mattresses, and you can sometimes substitute with hypoallergenic pillows. Pharmacotherapy, you would tend to use antihistamines, your first and second generation, most likely your Benadryl, cetirizine, loratadine, anticholinergics for those severe cases, mast cell stabilizers for those that are really severe. So these are prescribed by your ENT physicians or immunologists. Anti-leukotrienes, which is also such as your Montelukast and Zafir-Lucas, these are also prescribed to asthmatic patients as a supplementary pharmacologic management aside from your steroids to lessen the inflammatory reaction within the body. So decongestants also good for nasal obstruction, but very little effect on other symptoms. So steroids are still best for any form of rhinitis. Problem with steroids, you cannot take them for so long. Otherwise, you tend to have immunocompromise, and also it can for the elderly, no? As you know, you do not put your patients on steroids for a long time. Otherwise, it would cause a lot of systemic problems. One of them, or as you may as well know, aside from immunocompromise, they can also cause osteoporosis because your steroids also hamper your bone density in the long run. So this is a chart used generally for the physicians. So again, as you can see, the hierarchy, no? Allergen avoidance is still the best. And then for mild or moderate severe allergic rhinitis that is intermittent, you use your H1 blockers or your antihistamines together with a intranasal decongestant or intranasal steroids. For those with persistent symptoms, they tend to have a more severe presentation. Therefore, it warrants them more or less on longer duration for steroids and even anticholinergics. So if there's no improvement, they would be referred subsequently to the specialist. Generally, another treatment for that is immunotherapy. So immunotherapy is a specifically prepared antigen that is administered subcutaneously to induce a systemic tolerance to foreign protein. Disadvantage, adverse effects. It has a lot of adverse effects ranging from mild to severe, and then some people would have no response to it. Effective when optimally administered. Problem with immunotherapy, quite expensive. So generally nowadays, before people tend to move to immunotherapy, they would seek other alternative or supplementary form of treatment. And one of them is acupuncture. No? Problem with this one as well. You need injections every week for 2 years. So just imagine injections every week for 2 years. So most common failure is patient compliance. Brief immunotherapy is being designed to shorten the duration of treatment. So aside from expensive, this one would also require you to have a great compliance for 2 years. So why not just try acupuncture as an alternative or supplementary healing modality for AR? No? Next, hopefully you don't reach this. Some people, those that are recalcitrant signs and symptoms, they would have surgical options. No, most of the time you do this for nasal obstruction. either by cauterization or laser treatment, mucotomy, wherein you resect a tissue strip from the lower edge of the inferior turbinate. Then for serious pathology wherein you have nasal septal deviation, septal spur or ridge, septoplasty can be performed. So it's associated with sinus complaints. Endoscopic sinus surgery may also be required. So this is reserved for those that have recalcitrant AR. So to summarize, again, I cannot overemphasize the importance of allergen avoidance. Then eliminate IgN, increase IgG. So basically what they're saying is boost the immunity of the patient and then try to lessen their dependence on antihistamines, anti-leukotrienes, and even your steroids. So, after dealing with allergic rhinitis in the Western point of view, let's go over to the TCM point of view. So, an allergic rhinitis generally is diagnosed as a deficient syndrome. 10% may develop to asthma. So, TCM differentiation. You have first differentiation, lung deficiency, concomitant with cold and wind attacks. So the main signs and symptoms of this one would be aversion to wind and cold, shortness of breath, pale complexion, coughing with white sputum. Since it is an exterior type of pathogens invading, you would have a pulse that is superficial and also rapid. Tongue can have a thin and white tongue coating. So generally, I'm quite sure some of you here have already attended Dr. Hector's lump training diagnosis on tongue. So I will not delve much onto that because I know he has taught you well on that. So for the first one, it's lung deficiency together with cold and wind attack. For the second differentiation, we have the spleen chi deficiency. So your main signs and symptoms will be itching in the nose with lots of sneezing, profuse, thin, clear nasal discharge or loose stools. And because of your spleen chi is weak, your spleen and stomach is in disharmony, so you will have loose stools. And when you check the pulse, it's steady and weak, and your tongue, it's pale with white tongue coating, most often than not swollen, and sometimes with teeth marks. No? So your spleen chi deficiency, see, you can see your tongue body that is pale with a thick tongue coating, not to mention a midline crack on the area of your spleen and stomach. No? Then number three, kidney yang deficiency. Main signs and symptoms, itching in the nose with lots of sneezing, nasal obstruction, pale mucus, aversion to cold with cold limbs, clear urine with increased volume, worsens with wind and cold exposure. So your pulse would have a thready and deep presentation coupled with a tongue that is pale with a white tongue coating. So when you have kidney yang deficiency, concomitantly, you would also have urinary symptoms as well. Okay. So for allergic rhinitis treatment, the treatment principles for the acute stage, you treat the secondary signs and symptoms first. If not severe, treat the root cause. So generally, a general rule of thumb, reinforce your antipathogenic chi and remove the pathogens, promote dispersing function of the lung. No? So best time to tonify would be 10 in the morning to 2 in the afternoon. That's the best time to tonify your antipathogenic chi. Then for your point prescription, the main points, most of you, I'm sure, have punctured one way or the other your Li20 and your extra point yin tang. So these are local points for decongestion. Gallbladder 20 at the back of the neck to expel the wind. Stomach 36 and Li4 points of the Yangming meridians. So you can use them to reinforce antipathogenic qi, promote qi production and circulation. For me, I would also add Sanjiao 5 or triple warmer 5 to dispel external wind. So for me, I tend to use most of the time stomach 36 and Li4 for allergic rhinitis as my main points. Then for supplementary points, you can use the back shoe of the lung or the yuan source point of the lung, which is bladder 13 and lung 9. So this syndrome is most apt when you diagnose your patient to have a lung deficiency type. So the purpose of these 2 points is to tonify the lung. Then counterpart for the spleen, you can use to tonify the spleen bladder 20, spleen 3, and ren 6. No? Then also For kidney tonification, you can tend to use bladder 23 and run 4 for kidney deficiency. No? Then for supplementary points, no, you can use Li11 and do 14 to clear the heat. Then do 23 and stomach 2 for the stuffy nose. Spleen 9 and spleen 6 for profuse nasal discharge. Bladder 2 and bladder 7 for headache and eye itching. Lung 7, run 22, bladder 13 for cough. And then for asthmatic breathing, your famous point, Ting Chuan, or your stop asthma point, that is located zero point 0.5 Tsun from your spinous process of your C7, no, laterally. Also CV17 or run 17 at the chest, between the nipples. So you can use that for shortness of breath and asthmatic breathing. And those with emotional components attached to it, you can also use bladder 18 and liver 3 because as we all know, liver dominates the emotions and can help with your with your emotional and chi flow circulation. And also for the ear acupuncture, aside from your windstream point, you can also use your liver points so as to tonify your liver problems as well. Also the lung, because lung can dominate the skin. So using them can also help for your treatment or supplementary points so as to boost the patient's immunity as well as your lung health. No? Other treatments, moxibustion, stomach 36 and GB20. Moxibustion specifically at stomach 36, it's used to boost the immunity of the patient. And then you can also use that, no, to disperse heat, wind as well, because moxa, as we know, generally is a tonifying treatment. Other treatments that you can use are medicinal plaster with herbal medications on it, just like here in this picture with my classmate. So he has a medicine TCM herbs or TCM paste together with a patch attached to Do14, bladder 13, and bladder 17, and also for your GV9, also for the spine, so as to boost this person's immunity. No? Other treatments, dry cupping or ventosa, also a good method to disperse your wind pathogens, your cold pathogens, and even the heat pathogens. So if you're practicing dry cupping, well and good. Other treatments, they would use acu-injection, wherein you inject a solution of the TCM herb, your Radix astragalus or astragali, also known as Huangqi in Chinese. Then for Western medicine, some people would tend to inject with steroids or steroid injection. So we have two schools of thought. Okay? So that's basically for allergic rhinitis and its treatment. Now, let's go over to some very interesting evidence-based medicine for acupuncture for allergic rhinitis. So I did a bit of research, and here is an article that came out in April 25, 2022, just this year. So an acupuncture for allergic rhinitis, a systematic review and meta-analysis by the Chinese physicians. So the study, they tend to accumulate multiple RCTs to determine, to compile evidence on the overall effect, no, for acupuncture for allergic rhinitis. So the results, no? Acupuncture improved the nasal symptoms on the total nasal symptom score or your TNSS with the quality of life measured by your rhinoconjunctivitis quality of life questionnaire, RQLQ. So it states here that the results generally states that there was no clear difference was observed between acupuncture and your antihistamines. The effect of acupuncture for children or even adolescents with AR are still unclear due to insufficient data. So basically what they're trying to say here is that acupuncture may have an advantage over no intervention or sham acupuncture in improving nasal symptoms and quality of life for adults with allergic rhinitis. The effect of acupuncture and cetirizine or loratadine for allergic rhinitis may be similar. So it has a equal effect generally what they're trying to say. So between the two, if your patient is asking for a good alternative treatment aside from taking your antihistamines, you can recommend acupuncture because according to this systematic and review and meta-analysis that came out just this year, acupuncture is equal in terms of efficacy with your antihistamines, no? So let's take a look more. Let's delve deeper. So, they also found out that acupuncture may modulate biomarkers, including downregulation of your substance P, VIP, and total IG to relieve the symptoms of AR. In 2015, the American Clinical Practice Guidelines on Allergic Rhinitis listed acupuncture as an optional therapy for allergic rhinitis. So this is just a flow chart of how they gathered the records or those trials. So they were able to start off with around 800, then eventually narrowed down to 27 to be included in the meta-analysis. So some highlights, no? If you can see the study in 2014 and 2008, both done in Germany, they did manual acupuncture for a period of roughly 2 months. So in 2 months, they did 12 sessions. Um, in this slide, unfortunately, there was no mention of what acupuncture points they use, but generally, one way or the other, some of the points that I have shared with you a while ago, you can bet they use that in these respective studies. So basically, what I just want to show you in this table would be the duration of their treatment. So if you notice, you have to give roughly more than roughly 10 sessions for around 2 to 3 months, coupled together with the studies in 2015 from China, Korea, and Hong Kong. They did acupuncture. Take a look, intervention 3 times per week or 2 times per week. So you have to give it continuously. So their outcomes are what we have mentioned before, your TNSS and your RQLQ. So they're just evaluating the efficacy of acupuncture versus your antihistamine. Basically, I just want to tell you on these different studies that number one, when you do your acupuncture treatment, you have to do it 2 to 3 times per week. Then you have to do it roughly 2 months at most to 3 months, no? So continuous session or continuous consistency is of key importance. Then some people, they would do acupuncture once a day. The study by Huang in 2012 and Dr. Li in 2003 in China, they did acu once a day for a month. And then unfortunately, the follow-up, they did not report it. So this is just a compilation of different clinical studies with regards to acupuncture treatment for allergic rhinitis. So as you can see, they do manual acupuncture most of the time. So this slide is a forest plot. For those of you that are not familiar with this, a forest plot would generally tell you the overall effect of your accumulated studies, whether or not they would favor a certain experimental intervention or your control. So let's take a look, no? So in the table A, it's acupuncture versus no treatment at all. They measure the total quality of life. And then basically for you to read this, specifically you have three small boxes of squares. Those are your weights for these studies. So remember, there's a line in the middle. It's 0, no? Remember, when your line crosses the midline of 0, generally we say that your treatment is non-significant or doesn't have an effect. So in this case, all three studies did not cross the line. All of them fall under favoring acupuncture. So the diamond basically is the overall effect of those three studies. So it did not cross the midline of 0. So what they are telling us for the acupuncture studies that has no treatment or compared with sham acupuncture in terms of quality of life, their overall effect favors acupuncture. And then letter B, the table here is acupuncture versus sham acupuncture nasal symptoms. So as you can see, for the overall effect of these two studies, they found out that it favors acupuncture over sham acupuncture. And then for letter C, acupuncture versus sham acupuncture for nasal symptoms as well. They would favor for acupuncture. And then letter D, acupuncture versus sham acupuncture for another quality of life. For these three studies, they have similar results wherein the overall effect did not cross your midline of 0. So the total forest plot or the indication of this forest plot tells us that these three studies has a common denominator of favoring acupuncture for allergic rhinitis. No? And then, what about acupuncture for Western medication? So for acupuncture versus Western medication, we have different studies here listed. So as you can see, no, some of them would cross the line, the midline, specifically your small squares and even your diamonds. No? Your diamonds are the combination of all the studies before it. So the overall effect or meaning or significance of this forest plot, there was no difference for clinical response between the two group, whether it's antihistamine or whether it's acupuncture treatment. So it basically states that acupuncture has no advantage over Western medication. They are almost equal in terms of efficacy or effect. And then this one, acupuncture with loratadine. The previous one was acupuncture versus cetirizine. So acupuncture versus loratadine, it's basically almost the same together with cetirizine. So if you notice at the most bottom, your diamond, your overall effect of all these studies compiled, it crosses or touches your midline, no, of 1. So when it touches the midline, it basically means that it doesn't favor either. It doesn't favor acupuncture and it also doesn't favor your antihistamine medications, meaning they're also equal in terms of efficacy. No? So, all trials supported that a combination of acupuncture and Western medication can lead to a higher proportion of clinical responses than Western medication alone. And then they found out that after treatment, nasal symptoms were less severe in the combination group of acupuncture plus Western medicine compared to Western medicine alone. So the impact of this study states that if your patient is taking antihistamines and you have a severe allergic rhinitis, if you add an acupuncture treatment as a supplementary treatment, the results are or effects are better, no? Rather than Western medicine alone. But eventually, our goal is to slowly taper those Western medications, specifically your steroids, no? We want to taper it and eventually wean them off for steroids so that they won't be dependent much on Western medication. So, it also notes that the levels of certain cytokines, such as your IL-4, 6, and IL-10, decreased when acupuncture was implemented along with Western medicine. Adding acupuncture to Western medicine was advantageous with regards to decreasing your inflammatory metabolites or inflammatory mediators. For children, no difference between real acupuncture and sham acupuncture in the severity of nasal symptoms. So the conclusion of this systematic review and meta-analysis states that for adults with allergic rhinitis, acupuncture is superior to no intervention and sham acupuncture in lowering the severity of the nasal symptoms and improving the quality of life of the patients. The effect of acupuncture and your antihistamines may be similar. Whether acupuncture can decrease the serum level of the immune response of molecules is still uncertain. The effect of acupuncture on children with AR remains unclear. So, next study came out in February 10, 2018. This one is the impact of acupuncture on antihistamine use suffering seasonal AR. So this is a RCT that was done way back in February 2018. So the patients are 16 to 45 years old, diagnosis of moderate to severe allergic rhinitis. So In this study, they randomized patients to do acupuncture versus sham acupuncture versus rescue medications such as your antihistamines and your steroids. So they did it for 12 sessions, no? Over a period of roughly 4 months, no? So what did they found out? So for this study, the points that they use, take a look. 4 obligatory basic points such as your Li4, Li11, Li20 bilateral, and your yin tang. And then they use 3 out of 8 facultative or supplementary basic points, which are your B-tong, extra point B-tong, GB20, liver 3, lung 7, stomach 36, spleen 6, sanjiao 17, and bladder 13. And also they, based on different practitioners, they would also add 3 additional points. But most importantly are the line in green, the 4 obligatory basic points, your Li4, Li11, Li20, and extra point yintang. So what did they found out in this study? So take a look. Baseline, they're quite similar. So this is the days of antihistamine use among these groups. And then when you do your your acupuncture, take a look. The acupuncture is the one that is colored in red. Your sham acupuncture is the one colored in green. And your blue is your rescue medication for Western medicine for AR. So what did they found out? When you do acupuncture and even sham acupuncture, no, they have a significant difference as compared to Western medicine, wherein they reduce the number of antihistamine use in terms of days. They reduce it as compared to Western medication alone. So generally, the acupuncture reduces the days of antihistamine use for patients. So take a look. In this next table, no, they have antihistamine use at baseline, no. So for baseline, the days of antihistamine use are quite similar. But if you look at the duration when they did your acupuncture and they followed the patient from 1 month to 1.5 months, take a look right after 2 weeks into the intervention going to 1 month. So 2 weeks to 1 month, the proportion of patients suffering from allergic rhinitis is the most lowest as compared to your sham acupuncture and your Western medication alone. So it tells us that acupuncture takes effect. It takes a while before it takes effect, no? But after 2 weeks, it reduces the number of patients suffering from allergic rhinitis. It is most lowest with 2 patients suffering, and then from sham acupuncture, 6 patients suffering from 1 month to 1.5 month in the treatment process. So after one month of treatment of acupuncture, the number of patients with AR in the acupuncture and also in the sham acupuncture is significantly less as compared to those that are using your Western medications. So they concluded here that acupuncture appeared to significantly reduce the days of antihistamine use while improving the quality of life and your allergic rhinitis symptoms. It can be considered a valuable additional treatment for option for patients with severe allergic rhinitis. So acupuncture significantly lowered the days of antihistamine intake in patients with severe allergic rhinitis compared with sham acupuncture and Western medicine. So they concluded that it can be considered as a valuable and additional treatment option for severe allergic rhinitis patients with the potential to reduce medication-related side effects. So another study that came out in January 11, 2018 is a very interesting acupuncture technique. It's called treatment of persistent allergic rhinitis via an acupuncture at the spinopalatine acupoint or your SPA. So this is a randomized controlled and double-blinded study to evaluate the efficacy of acupuncture for PAR treatment. So generally, as we state, we tend to use the basic points such as Li20, stomach 2, and stomach 36 in clinical practice. In this study, they are using only just one point. It's called the SPA point, no? for treating your persistent allergic rhinitis. So the SPA point is closely related to the stimulation of your sphenopalatine ganglion. So what did they find out in this study? The average total nasal symptom score in the treatment group was significantly lower than in the control group at 1 month or week 4. However, the scores in the two groups were not significantly different at week 12 or 3 months. Then the quality of life was significantly improved at week 2 in the treatment group compared to the control group. So during the follow-up period, the medication dosage in the treatment group was much lower than in the control group, and no adverse events were observed in either group during treatment. In this study, they concluded that the profound effect of acupuncture at the SPA on prevention of persistent allergic rhinitis development. So the TNS score in the treatment group with the depth of 50 millimeter or 5 cm was significantly lower as compared to a control group with a depth of only 2 cm. So acupuncture directly at the SPA to stimulate your sphenopalatine ganglion is an effective method to treat your persistent allergic rhinitis. So let's take a look more closer at this study. So this one is located in the cheek near stomach 7, no? Sorry. Um, Near stomach 7 or your Shagwan lower gate, which is generally used as the needling point for local nasal anesthesia. Technically, the needle is inserted through this acupoint to reach the pterygopalatine fossa to stimulate the sphenopalatine ganglion and other nasal nerve, increase nasal ventilation, and decrease the glandular secretion. So, this point, to locate this point, you need to locate stomach 7. So here is a picture, anatomically speaking, where stomach 7 is located. So it is located, no, here at this notch, no, at the lower border of the zygomatic arch in the depression anterior to the condyloid process of the mandible or posterior to the coronoid process of the mandible. So there's a depression there that that's the insertion point. And when you puncture quite deep, you can touch this yellow structure, which is your sphenopalatine ganglion. So when you use stomach 7, diba, generally it has an indication for deafness, tinnitus, otorrhea, toothache, facial paralysis, or even motor impairment of the jaw. But in this study, they did a study, no, when you puncture it deep at two depths, no, 2 centimeter and 5 centimeter. Specifically, when your needle is able to touch this yellow structure or your sphenopalatine ganglion, you would have a very good effect for allergic rhinitis. So this is a picture, actual picture, no. So as you can see, it's below your sa may patilya or sa hairline, or it's a approximately at the location of your stomach 7. So, this is an MRI or high resolution CT scan, sorry, of the pterygopalatine fossa in the coronal plane after the acupuncture showing needle penetration. So this is roughly 5 centimeter deep. So as you can see, no, your acupuncture needle would reach here at the nasal cavity, specifically at the back, to puncture your sphenopalatine ganglion. So in this study, they enrolled, no, 84 patients. Then they would do a real acupuncture versus a sham acupuncture. So this is just a characteristics of the participants. So usually they're in the middle age group with allergic rhinitis. No, so no significant difference were observed between these two groups of patients. And then take a look here. So basically the main outcome of this study was the nasal symptom score. So if you notice here, although it's not that significant, the nasal symptom score for the real acupuncture group is significantly lower than your sham acupuncture group. And then the nasal obstruction and sneezing improved at week 2 in the real acupuncture group compared to the sham acupuncture group. All the indicators improve at the end of the treatment. So the symptoms of nasal obstruction and sneezing improve in the real acupuncture group within 4 weeks of the post-treatment period. And the improvement in the nasal obstruction continued for 8 weeks after treatment in the real acupuncture group. No? And then, so this is just a follow-up for week 8 and week 12. So the most significant of this would be the nasal obstruction. So, and also sneezing. They have a very significant effect on this specific symptom. And then a follow up on week 16 by 4 months after doing this treatment, they found out it's not that significant. No? So here is a better representation of the outcome of those studies. So if you take a look, no, the asterisk, no, in these upper bars indicate the time points in which there were significant differences between the two groups. So the total nasal symptom score in the real acupuncture group was significantly lower than in the sham acupuncture group during the treatment and follow-up period. So both the TNSS and individual entry scores in the real acupuncture group were lowest at week 4. This was maintained, this efficacy was maintained up until week 8 or 2 months into the treatment. So for the other symptoms, no, take a look. Week 4 has the most significant improvement, or a month after you did your treatment, they have the most significant improvement for using the SPA point for improving symptoms of your allergic rhinitis. Okay, so this is a very good chart or detailed chart so as to show the improvement of symptoms. And here I was able to found a very nice picture of rhinoscopy. No? So take a look. On the left side, this is before you stimulate your SPA or before inserting a deep needle to stomach 7. So as you can see, you have a nasal secretion rhinorrhea, that sticky fluid there between your nasal turbinates. And then once you insert the needle and touch the spinopalatine ganglion, when your patient felt a jolt of electricity on his or her face, or sometimes electrical sensation radiating to the upper and lower parts of the teeth, immediately after, as you can see, it decongested. It opened up or widened the space of your nasal turbinates. So this technique is very interesting. It's fast and it's efficient. The problem with this one, it's a bit difficult to master because it takes a lot of practice for you to practice and experience for you to stimulate the SPA. But if you're able to touch the SPA at insertion at stomach 7 at the depth of 5 centimeters, then you would achieve an immediate effect of opening the nasal turbinates. So the SPG, or your spinopalatine ganglion in the pterygopalatine fossa, modulates your nasal inhalation, nasal sensation, vasomotor responses of the nasal mucosa, and glandular secretion. So once you stimulate that, you can help decongest. No? And then this is just a tabulation of the RQLQ, or your quality of life. Basically, I just want to show you here the different criteria. But basically, it has an outcome of sleep scores showed no differences between the real acupuncture and the sham acupuncture group. But the non-nasal or eye and behavior and emotion function scores showed significant differences between the two groups at weeks 2 and week 4. So the emotion function score showed significant differences between the real acupuncture group and sham acupuncture group at week 8. So this is a summary of the outline or outcome, no? So take a look. Week 4, at week 2, week 4, and week 8, you have a significant difference between your sham acupuncture group and your real acupuncture group. It is most lowest, or the best effects are seen after a month of doing the treatment. So they basically charted the patient's quality of life and symptoms using the TNSS and RQLQ score upon stimulation of your sphenopalatine acupoint at near stomach 7. So in conclusion, what does this say? Acupuncture at the SPA is an effective treatment for persistent allergic rhinitis as it may ameliorate nasal symptoms, improve QOL, and reduce the dosage of medicine. Acupuncture lowered the sensitivity of the nasal sensory nerves, balanced the ANS, downregulated the CNS sensation, and attenuated the overall nasal hyperresponsiveness. The SPA is a single acupoint that is used to treat your persistent allergic rhinitis, and repeated acupuncture sessions produce no adverse effects, thus strengthening its appeal and potential clinical application. However, in this study, they also concluded that further validation of these results with the larger scale trials could be decisive. Hopefully, in the future, they would have more researches on this technique for allergic rhinitis. Okay? And then next, in October 2015, by the Australian Journal of Annals of Allergy, of Allergy, Asthma, and Immunology, they did an acupuncture for seasonal AR, a randomized control trial. So basically, they did a 12 session during 4 weeks treatment, no, of acupuncture. So the results, a total of 175 participants was included. And they concluded that 4 weeks of acu treatment is a safe and effective option for clinical management of SAR in the Melbourne area for patient symptom relief and quality of life improvement. So as early as 2015, you already have evidences for allergic rhinitis and using acupuncture as a treatment modality. Okay, then for those that are afraid of needles, you might also want to explore the long snake moxa treatment for those with AR. So this one came out in August 2016, no? So a long snake treatment generally is pictured as this from your GV meridian or your governor vessel meridian from GB14 all the way to the sacral area from do 4 or even do 3, no? So you use moxa to tonify and boost the immune system in the hopes of alleviating the symptoms of allergic rhinitis. So when you do this, expect that you have a full of smoke. But for those that are afraid of needles, this is a good alternative for one way to reduce your allergic signs and symptoms. So other people would tend to use moxibustion via moxabox for certain local areas, such as back of the lung, the abdomen, the do meridian, to also boost your immune system. So the results, no? Mark improvements in their symptoms, and then your inflammatory metabolites are significantly decreased, while the plasma CAMP or CGMP ratios were significantly upregulated. So this would reduce pro-inflammation and upregulate your anti-inflammation parameters. So they concluded in this study that the long snake moxa treatment is effective in improving symptoms of AR patients, no? So which may be related to its function in mobilizing the immune function of the body. Okay, next. Acupuncture for allergy and urticaria. Let's take a look at some of the studies. So the most recent I was able to gather was in July 17 of 2020, treatment of acute urticaria with acupuncture. So this is a very interesting case presentation, case study that came out in the Journal of Baltimore, no? Journal of Medicine Baltimore in Maryland, no? So 30-minute acupuncture treatment was performed for a case study of patient manifesting with acute urticaria. So what did they do? They found out that the lesson for this study is acupuncture may be a promising alternative therapy to treat acute urticaria, especially for patients who cannot receive a drug treatment. So for this case presentation, take a look at this case sample. So the patient is a 26-year-old nurse. So during the night shift on June 11, 2019, the nurse suddenly felt itchy on the elbow and waist at 3 in the morning. Their scratching could not alleviate itching, and wheals gradually swelled up and spread to the knee joint, sideways, and especially the elbow part. The itching was unbearable and agonizing. The nurse was physically healthy and did not have any underlying disease. So these are the photos taken. The first picture is in the knee joint. The second is in the waist area, and the third is on the elbow part. Medical history of this person doesn't have any significant history of skin diseases nor history of allergy to food and drugs. Onset was still unclear, no, without any obvious inducement. So he was diagnosed to have acute urticaria with a urticaria activity score of 4. So what did they use? They used the Ying spring point or your lung 10, no, as the sole point to treat this case. So it was stabbed in by or the needle was placed in your bilateral lung 10, with the depth of 10 millimeter or 1 centimeter. After the needles were inserted, the needles were lifted, thrust, or rotated to obtain a Tzi sensation. The above manipulation was repeated every 5 minutes and the needle was retained for 30 minutes in total. So this is the picture of the actual case, what they did. So for those of you that doesn't remember lung 10 is located at your thenar eminence between the red and white skin, no? So so the nurse was, they don't have any medication at hand during that shift, but instead what they did was an acupuncture. And the results is this. After 5 minutes of needling, the itching sensation was significantly relieved and the patient could subjectively control himself from scratching. The wheals gradually disappeared at the knee joint and the lateral waist and the elbow. After 30 minutes, the wheals practically vanish. So this is a before and after picture of using lung 10, no? During the flare-up attack of acute urticaria, then bilateral lung 10 was punctured for 30 minutes. Actually, after 5 minutes, itching sensation was relieved already. And then the wheals gradually disappeared after 30 minutes. So, on analysis, wind is the fundamental pathogenesis as what we have discussed. Treatment should be centered on expelling wind evil, no? And a while ago, another reason why splinten is my favorite, it's because to treat wind, you must first treat the blood. And when the blood moves, wind naturally disappears. There's also a theory that lungs govern the skin and the hair. So lung 10 was selected because lungs govern your skin, and acupuncture at lung 10 could stimulate blood and energy circulation in the lung meridian, resulting in wind disappearance and expected curative effects. So the causes of urticaria are complicated, which are normally exogenous and endogenous. We already discussed the activation of mast cells a while ago. And I want to emphasize here that acupuncture can activate endomorphin-like substances, inhibit and block the transmission of pain and itching signals, thus realizing the analgesia and antipruritic effects, regulating the immune system, and inhibiting allergic reactions. Scholars have found that acupuncture treatment of urticaria shows bidirectional regulation on the immune system, enabling it to work in the normal or optimal status. So, again, the lesson, Acu may be a promising alternative therapy to treat acute urticaria, especially for patients who cannot receive a drug treatment, such as in this case, during a night shift by the male nurse. No, they don't have any Western medication stock on hand, so they decided to do an acupuncture at lung 10. And last but not the least would be May 25 in 2016. Effectiveness and safety of Acu for patients with chronic urticaria, a systematic review. So they have this in the 3 trials show significant difference between acupuncture and drugs in global symptom improvement. As an adjuvant to medication, acupuncture was also beneficial for global symptom improvement. There were no severe adverse events related to acupuncture. So they concluded in this systematic review, acupuncture might be effective and safe for chronic urticaria in relieving symptoms based on a low level of evidence. So this is just a flow chart of what they did. 700 records was identified and eventually it was filtered, selected with the studies based on their inclusion criteria. Eventually, 6 studies was included. So the 6 studies were all done in the year 2000, the first decade of year 2000. So they tend to compare acupuncture and even electroacupuncture versus your antihistamine Western medications. And the outcomes were measured at 2 weeks and 4 weeks into the course, your global symptom improvement, no? So what did they use for these studies? Basically, in most of the studies, 4 out of 6, they use spleen 10, stomach 36, LI 11. Other acupoints that were used were spleen 6, LI 4, bladder 20, bladder 18, and GV 11. So the duration of the treatment intervention was 2 weeks or 2 trials, or even 4 weeks or 4 trials. Frequency of intervention ranged from once per day to twice per week. No? So, what did they find out in the global symptom improvement for patients with chronic urticaria? So, according to these 3 studies, most studies with an overall effect. One study has says it has no effect. The other study by 2006 by Dr. Tang and Chen in 2009 also showed no that it favors the experimental. So overall, when you combine these 3 studies, no, there was a statistically significant difference between acupuncture and drugs in the global symptom improvement, favoring your acupuncture treatment. And then for this subgroup also, this one also forest plot comparison, acupuncture plus medication versus medication alone. All of the study favors experimental. So with an overall effect of 1.77, the diamond, there was a statistically significant difference between acupuncture plus medication and medication regarding global symptom improvement. So acupuncture in this the discussion might be more effective than drugs. Acupuncture plus drugs was superior to drugs in improving global symptoms. It indicates that acupuncture might have beneficial effects for the treatment of chronic urticaria as an adjunct to medication. However, the overall quality of evidence assessed by the grade approach for this meta-analysis was low. There was a high overall risk of bias in the 6 included trial, which has also been found to be a common phenomenon in previous Chinese studies. So, in conclusion, there is low quality evidence for the effectiveness of acupuncture for chronic urticaria in relieving symptoms based on the results of this meta-analysis. Acupuncture is safe for treating patients with chronic urticaria according to the current evidence. However, the evidence is still low. Hopefully, more future studies can be done about acupuncture and chronic urticaria. But it's nice to hear that acupuncture is a safe modality for treating patients with chronic urticaria according to the current evidence. So, my take-home message for you, no? There's a very famous chart in way back no in Rome, no, and it states that this chart, all roads lead to Rome. Basically, what I want to say is whatever treatment modality you use, whether acupuncture, whether moxibustion, gua sha, ventosa, cupping, immune boosting therapies, all of them one way or the other can help in terms of alleviating the patient's signs and symptoms. There's no superior acupuncture technique, nor is there any superior treatment over the other. So every patient has their own suited kind of treatment for their respective signs and symptoms. So whatever treatment modality that you use, just be confident in yourselves and believe that you can heal the patients with your healing hands. So with that being said, thank you for your kind attention. Thank you for your time for attending our charity Christmas lecture for the PAI members. And I therefore want to wish each and every one of you happy holidays. Wishing each and every one of you a beautiful holiday season. As the president of the Philippine Academy of Acupuncture, um, please do spend time with your family and friends during the festive holidays because nothing is more valuable than the love of family and friends. So, with that being said, thank you and thank you for listening and have a pleasant evening to all of you. Okay.
You have any questions from the floor? Any questions? But we're getting a lot of beautiful responses thanking Paai and our speaker for the exhaustive lecture. It's truly very informative. I'm not seeing any questions. Yeah, but a lot of thanks. Yan, tanong. But this initiative, this Christmas webinar is really very much in line with the PAI vision mission, no? Because I don't know if everybody's familiar with the fact that, of course, we know that the Philippine Academy for Acupuncture is an organization of medical and non-medical.
Tapon mo na nga to. Ano anak mo? Doon meron mo.
Really recognized by the Philippine Institute of Traditional Alternative Healthcare. The intention of putting a PAI would include, of course, initially we really wanted to promote and develop quality education. PAI is really intended to help with training and research in acupuncture, apart from quality education, to professionalize the practice and to improve the quality of TCM acupuncture practice, to promote the science of TCM acupuncture, to encourage cooperation, camaraderie among members, to promote also the earth-friendly practice of TCM acupuncture, to ensure the integration, of course, the integration of acupuncture and traditional Chinese medicine into the Philippine healthcare system. Yun. So, if we just keep on as our president, Dr. Webster Wilbert Lim, is really right in saying all roads lead to Rome. If we persist and we work as a team, we will eventually get there, really bring acupuncture into the Philippine healthcare system, integrate this into the healthcare system so that we can have more options. Yeah, very informative lectures. Okay. It's really very relevant according to some. Yeah, we are most likely, it's the best and relevant, very relevant for us to know the Western side counterpart. Yeah, because it's really integration. So we're showing, and of course the research aspect, the evidence for all of this initiative, all these interventions, these modalities are very important. Oh yeah, there's a question here. How do we do the acupuncture in children who suffer from these allergies? Is there a special technique for the young patients? Ayan. Dr. Webster, would you like to answer that question about children?
Yes, good evening to each and every one of you. Thank you for listening. Yeah, actually, that question was asked by Doc Oli, no? Acupuncture for children, most of the time they do acupressure kasi children, as we all know, are very hesitant to needling techniques, no? So most will do either acupressure or tuina massage techniques. So in relation to the first question a while ago, while I was reading the chat box, Kat Miranda asked, no, what is the most recommended or used acupressure point for allergic rhinitis? Most commonly used is LI20. And then for the distal part, the most commonly used it's either LI4 or stomach 36, no? Because we all know LI4 is a command point for the face, and then stomach 36 is of course an immune booster. And then aside from the acupressure from these points, They do a spinal massage for children at the back just to boost their immunity. So they would focus more on the back shoe points, no, to stimulate so that they're trying to build up the immunity of children so as to counteract the incidence of AR for this kind of population. But thank you for those questions, po. Other
Yeah,
questions?
very nice. Yeah, any other question? That is
Yeah.
good.
Eto, somebody asked, no, the SPA ganglion acupoint looks scary. Yeah, indeed, no? Kasi number one, you would stick a very deep needle to reach that. Actually, if you notice the study, the control group nila, it's 2.5 centimeters deep versus a 5 centimeter deep acupuncture depth for the SPA. It's scary in a sense that you have to stick a very long needle, especially to the temporal side ng
Yeah,
to the stomach 7. But if you're able to do that, if you're able to touch that, the effects are quite fast and miraculous. No, it takes a lot of practice. So again, before you do it, utmost importance, you would always explain what will happen, especially what will they feel. Most of the time, they will feel a jolt of electricity pag na-touch nyo yun. Parang nakakagulat in a sense, no? And then right after, parang manhid na manhid or ngalay na ngalay yung feeling. So yeah, thank you for that question.
yeah, thank you very much for that question. And maganda rin yun, Doc Web, that we really inform the patients about what's going to happen, especially if it's going to be like a jolt of electricity.
Yeah. Here's another question. May I, according kay Doc Lisa. Hi, Doc Lisa. Good evening. So how deep should you puncture the SPA? Actually, in the article, the minimum depth is 4.6 centimeters or 46 millimeters. So roughly round off to 5 cm. Okay, sure. Other questions? Here's another by Dr. Tiu Bali. Acupuncture work as a preventive measure for food allergy. There's two schools of thought to this. Actually, this is still a gray area. Most people are asking, no? Number one, not totally preventive, but most of the time what I have read is that it will decrease one way or the other, either the frequency or the severity of the reaction to the food, no? Preventive totally hindi Kasi once you inhale those so-called allergens, no, or you intake these allergens, remember, your tawag dito, your B cells has already antibodies to that. So once na nag-sensitize ulit yan, definitely you would have a reaction for that. But you can lessen the reaction by using acupuncture. Actually, it's either you reduce the frequency or you reduce the severity. Okay? Yes. Okay, another question by Lori Joy Diaz. Is there another lecture you can do for us, such as psoriasis? It's like similar diagnosis in urticaria. Unfortunately, for now, wala pa akong lecture for psoriasis. I think Doc Hector, the famous lamp guru, can help you with that for especially for TCM diagnosis. But for me, as of now, wala pa I haven't done a lecture about psoriasis.
I think, Doc, that would be that could be we would need a dermatologist for that.
Yes.
Practices acupuncture. So I'd like to suggest Dr. Mercado.
Okay.
Wala po akong...
Okay, are there any other questions?
Po yan kasi we can we line up already the next few sessions that will really be helpful.
Okay, yeah, follow-up question by Kat Miranda, no? What to watch out when needling the SPA? Number one, if you're able to insert that deep, roughly 4.6 centimeters, you know you're doing it right. Watch out for, especially the sensation for the patient. Kasi once you touch that talaga, electric sensation throughout the nasal cavity or facial area. How would we know we are puncturing the right area? Yeah, when you have that sensation. medyo may matatouch and magugulat most of the time the patients. They would have a very strong C sensation when you're able to touch your SPA. Good. Good questions. Other questions? Perpendicular, yeah. Usually perpendicular towards your, di ba? Your between the condylar and the condylate process of the mandible, there's a depression there. Dire-diretso. Pag hindi nyo po mapasok ng dire-diretso, ibig sabihin, you need to readjust your insertions. As another Letty, our hardworking PAI secretariat. Skin problems and other allergies also occurs for COVID patients. How can we help them if we cannot puncture them? You simply boost the immunity. You can do moxa, you can do your TCM nutrition, you can do your TCM herbs, Filipino herbs, integrative, homeopath, naturopathic methods, acupressure. Yeah, you can do them to boost immunity. Follow-up question by Lori Joy Diaz. How many minutes exactly needling the SPA? Depends on how you master the technique, but it can be done ideally under a minute or two. Once you felt that sensation, remove the needle, then okay na. The treatment is finished. Good questions? Other questions? Any more questions? Okay, a while ago, somebody was asking me, no, not on this audience now, what about moxa? Doc, can the smoke of moxa trigger an AR attack? Yeah, personally, I've seen the smoke of moxa can trigger an allergic rhinitis attack. So for this kind of patients, moxa is not suited for them. Any mga smoke, kumbaga, they're very hypersensitive. We ask them to wear your mask or even a gas mask for it, no? Then you should do other treatment modalities to address their problem. Sure. Yeah, thank you also to everyone for listening. Exact protocol for COVID patients with allergies? No, there's no clear-cut protocol. Wala po tayong clear-cut protocol, only suggestions or your CPG, but no exact protocol. Good. Other questions? Thank you. Merry Christmas. Yes, Merry Christmas to you, Oliver. Thanks for listening. I hope you like the Christmas lecture, Christmas gift, no? Christmas gift of knowledge. I think that will benefit you in your practice. Yeah, one side lang. One side. Yes, for SPA, one side puncture.
That's good.
What about laser acupuncture? Interesting. Actually, I have a separate topic for that, laser acu. But between the two, most of the time you will have a faster effect when you use the traditional needles. Laser acu, they're quite good for wounds, actually. More or less for wounds. Herbal medication intended most to AR. Actually, you have a lot From TCM, it can range from Huangqi or your Radix astragalus, and for other TCM herbal meds to disperse wind, no? Most of the time. For Filipinos, most of the time, boosting Filipino herbals, boosting or lagundi for lung problems, di ba? That's one of the 10 herbal plants, no? For recommended by DOH, especially for lung problems po. But there's no clear cut po AcuPen for SPA works similar for electroacupuncture. It can also help. It can also help, but there's no clear-cut study on that pa No RCTs done for it. Sure, good questions. Yeah. Ilan minutes? Generally, recommended usually, di ba, some people when they do AcuPen, they do a 30-minute. Other people, they do 15 to 20 minutes. Depends po on your call po. And based on the settings of your specific occupants. For SPA, the affected side, there's a lesion, will the other side do? Yeah, usually it doesn't matter whether left or right would you puncture, no? As long as you stimulate the SPA. So for example, on the left side, you have a scar, wounds, or lesions. Of course, we would use the other sides. Now, people are asking, what if both sides you have? Then just use your traditional LI20 or LI4 po. So you adjust according to the case po. But good question, Sir Yuri, no? Thank you. Doc. Good. Meron pa ba? Other questions? For those that are not able to watch, I think we have this is recorded naman. So you can rewatch, especially on the holidays, if you want to learn and relearn for the techniques for AR, Acu for AR. Yeah.
We will make this available to the members, no?
Yeah. It's our gift to them. Sure. Kung wala munang questions, no, I'd like to take this time, no. First and foremost, I want to send my greetings to two persons, no. First is our current bot member, Doc Christy Andaya. If you're here, we'd like to wish you happy birthday. Have a great day and wishing you a good health and all the best in your endeavor. The other birthday celebrant we have today is our previous PAI bot member, Doc Mikey Vergara. No? So if Doc Vergara is here, I'd like to wish him happy birthday as well. Stay young and healthy looking as always. No? So happy birthday and happy holidays. Then if you have no more other questions, I'd sincerely like to thank each and every one of you for your time, for attending this charity lecture of acupuncture for AR. I hope it can help you with your practice and reinforce what you have learned, because I'm sure all of you have learned acupuncture already, especially for AR one way or the other. So today, my goal is just to reinforce what you know and maybe open up other modalities for how to address AR. So with that being said, yes, our PAI Secretariat is requesting a group picture. So paano ba yan? Open the videos ba? Or what?
Yes, let's open our videos for the beautiful smiles.
Beautiful smiles. Okay.
Are we done?
Tapos na ba?
Na? Tapos na beautiful smiles?
Hindi pa raw.
That was when...
Dino, kaya mo yan. Kaya mo yan.
Sandali lang, nire-ready ko.
Sige. Habang nire-ready mo, I'd like to personally thank Dr. Jessica De Leon for moderating or being my MC. I'd like to acknowledge the presence of my bot members, Doc Hector De La Cruz, Sir Jackson Tan, and also Letty for helping, coordinating, and making this Christmas online webinar a success, no? So most importantly to the PAI members, thank you for your continued trust to us and thank you for your time in attending our lectures. So happy holidays to each and every one of you. Enjoy the holiday season.
We also acknowledge Dr. Quirino, BOTBP, former BOTBP from La Union. Thank you, Dr. Quirino.
Ready, smile.
Captured? Tell us when you're done.
Second slide po.
Second.
Nagkaka-allergic rhinitis ako tuloy.
Oh.
Hindi na na yung
Internalized.
Camera.
Dino!
Ay, pa. 1, 2, 3.
2, 3. Smile.
Thank you, Sir Jackson.
Thank you.
Ano pa? Third page? Ilang pages pa? We done with the third page. Page.
Okay na po.
Yeah. Okay, good.
Attendance, pagsarado camera.
Yeah, nandito pala yung two favorite suppliers natin, no? Si JAJM kay Joy Coro and AcuQuest Needles by Annette. So, thank you for attending. Happy holidays. More blessings to your businesses, no?
Ay, may question.
Tubig lang yung mahalaga. Tapos na tayo mag-capture ng smiles.
Are we done? Are we done?
Na.